Okay, I'm going to quickly talk about pains and discomfort we can get in the shin area around the lower limb. This is often referred to as shin splints, but shin splints is a general term for a group of conditions. I'm going to quickly just talk about the type of conditions you can get. So on the outside of the tibia, here we have the tibia coming down the middle, and it's in that part of the leg. And on this side here is generally a compartment type issue. This is where the muscles, the tibialis anterior, that comes down, attaches onto the top of the arch, which is helping lower our foot down when we hit the contact phase. And then just the side of it, the extensor tendons, which come down onto the big toe and onto the toes. And they're helping lower the foot down onto the floor, stabilizing the toes during that contact phase, and then lifting the foot as we go through the swing phase. So if the foot is pronating further through that stance phase than it's happy with, these muscles may be active for a little bit longer and will become sore and inflamed during that process. Often people will present with that a discomfort across the front of the foot as well, and a feeling of having the shoes too tight. But it's often related to how these muscles are working across the front. On the inside of the tibia is the classic shin splint type problem, where it's actually medial tibial stress syndrome. And here, where the tibialis posterior and the soleus muscles attach onto the bone, and they're pulling against the bone as we're loading the foot, there is also a bending and a rotational moment going on through the bone as well. So when we hit the floor, the tibia is slightly curved and it's designed to compress top and bottom. There will also be a rotation element going on as well. So that combination of the loading, the rotation, and the pull of the muscles is generally what's causing the irritation. The pain is usually in that lower third of the tibia and is very uncomfortable when we can feel down the inside of the tibia bone. There's sometimes little bumps, little nodules across it, but that's the bit that's really painful through here. Now on the outside of the leg, we have the perineal muscles. And if the foot is not pushing off through the big toe, but going over onto the outside of the foot, then the perineal muscles are activated for longer again than they're happy with, and that can put strain through those.